First of all, I welcome our speaker and all the doctors who have been there for today live. Doctors, for the today talk, more of focusing the topic would be on miracle of hearing. Sir, Dr. George Kurvi is a pediatric ENT surgeon plus HOD of ENT department, Lourdes Hospital, Cochin. Sir has been known to across the India because he has been done a lot of presentation in so many conferences. However, I would like to have few introduction about sir. Dr. George Kurvilla sir has been studied MBBS at Manipal Academy, MS ENT in Rajiv Gandhi University, Bangalore, University of Alberta at Canada, did FRCS in Royal College of Physicians Surgeon at Glasgow. Also, I wanted to mention there are many awards have been won by Dr. George Kurvilla sir. Sir has got first rank in Master of Surgery in MS ENT, University examination conducted by Rajiv Gandhi University at Bangalore at September 2002. Also, sir got the certificate of Best Dissection at 50th Temporal Bone Workshop for micro ear and skull-based surgery conducted by Otology and Skull-based Group. Also, I wanted to mention that sir has got gold medal for best consultant paper at dynamic slow motion video endoscopy in East Asian and tube assessment. With this, I would like to hand over the session to Dr. George Kurvilla sir. Sir, over to you, please, sir.
Thank you very much. Good evening, everyone, and thank you very much for this. And especially, I would like to thank Cipla Nurture Division for giving me this opportunity to present this talk today. Hearing loss is a passion of mine, and that is why I thought I'd talk on cochlear implants today. This is the hospital I work in. It's a Lourdes Hospital in Cochin. It's a 600-bedded tertiary care center. Before I begin this talk, I thought I'll give a short video of a day in the life of a deaf person that kind of gives an idea of what we're going to talk about. Now, this is a lady who is deaf and who is in a restaurant with a lot of friends, and they're all talking, and she cannot understand anything that they're saying, and she feels dejected and left out of this talk. This is the video. You'll hear a lot of noise in the background.
What happens short-term future are they? Why would you want to drink a milk that tastes like a They say you didn't even see that. They say you're disgusting. I hate the way they look. I don't like them. Really? No. Super raw. You didn't see that. You didn't see that.
What do you think about this way? Pawn shop didn't.
It's for like 250 gigabytes versus tape and a
You know how to drive. The car can hit in your brain.
This is your idea that hearing loss or deafness is not just about not hearing sound, but rather loss of contact with another human being. And it creates a lot of psychological issues, both in children and adults. Issues like delayed speech, poor communication skills, loss of confidence, and withdrawal from society, etc. So this is where cochlear implants come into play. It's a miracle device that has helped a lot of individuals with this problem. Now, cochlear implant is a prosthetic replacement for the cochlea and is only appropriate for adults and children who receive minimal or no benefit from a conventional hearing aid. I think that's the key here. When a person who is hearing impaired receives no benefit or very minimal benefit, that means the person can hear the sound but not understand. That means that the hearing aid is not working, and therefore we may need to consider cochlear implants. So to understand the basics of the implant, let's go into a short video of the mechanism of hearing. When sound vibrates in the ear canal, the tympanic membrane vibrates, causing a vibration of the three tiny bones, the malleus, incus, and stapes, which in turn causes vibration of the fluid in the cochlea. And it's this vibration of the fluid in the cochlea that transforms sound into electrical impulses, which then pass through the eighth nerve into the brain, and that is why we hear. If you look at one of the cylinders of the cochlea, if you cut the cylinder and look inside, this is what we see. This is one of the cylinders of the cochlea. It has got three chambers. the scala vestibuli, the media, and scala tympani. And they have fluids. There's a perilymph and the endolymph. Now, in the scala media is the organ of Corti, which is the important organ for hearing. And this is a zoomed image of the organ of Corti. You can notice that black lines, these are the hair cells of the inner hair cells and the outer hair cells. And it is the movement of these hair cells that convert sound into electrical impulses, which then travel through the nerve into the brain. Now, let us suppose the hair cells were damaged or were not present at birth, like in the next slide. There are no hair cells, so all the vibration is taking place, but because of the absence of the hair cells, sound is not converted into electrical impulses, and therefore the person does not hear. Now, cochlear implant consists of two components. This is the actual implant, which is implanted under the skin, and this is the external device, which is the speech processor. This is short animated video to show how the surgery of the implant is done. An incision is made behind the pinna, and the device or the implant is inserted. When we look inside, this is the cochlea with the 8th nerve. A small opening is made in the cochlea, and the electrode of the implant is then inserted all around. We have the speech processor, which is connected to the inside implant by a magnet. How does this device? This is the external device or the speech processor. It's got mics which pick up sounds. It picks up sounds and converts the sounds into codes. It's these codes, sound codes, that travel into the implant by radio frequency. The implant sends these signals along the electrodes, and they stimulate different areas of the cochlea, which represent different frequencies of sound. And it's by stimulating the different parts of the cochlea, we get different frequencies of sound, and that is why the person hears different sounds. Now, here, I'm just going to show a short video of how the implant is inserted into the cochlea. This cavity that you see here is the mastoid, the bone behind the pinna. And through the mastoid, we see into the cochlea. This is the round window, and we make an opening either in front of the round window, or we insert the electrode through the round window. Here we're drilling just in front of the round window, and that's called a cochleostomy. It's an opening into the cochlea. It is through this opening that we insert the electrode. This is a very delicate process. This electrode is then sealed with soft tissue. Here you can see the animated picture of the cut section of the cochlea with the electrode in, and it's stimulating different parts of the cochlea. Now, who is a suitable candidate? It could be a child or an adult with binaural, severe to profound hearing loss, and wearing hearing aids, but receiving little or no benefit from these hearing aids. And they're not able to understand speech. They can hear sounds, but cannot understand speech. The risks for cochlear implant are just like any other ear surgery. It takes about 3 hours for each side. So how is this process for selecting the candidate for an implant? Now, we have the newborn screening program where an autoacoustic emission test is done. If the first test is REFA, that means that the instrument has not picked up any signals, then we repeat the test after 2 weeks. If the second OAE test is also REFA, then the child undergoes a BERA test, that is a brainstem evoked response audiometry. And that tells us if the child has hearing loss and the severity. Followed by CT and MRI scans, and then the patient undergoes surgery for cochlear implant. Following surgery, we do the mapping. And mapping it's in the mapping that the implant is switched on. The switch on takes place usually about 2 to 3 weeks after the cochlear implant surgery. And when the child hears sound for the first time in their lives, it's an alien sound. They get scared. They may cry. In fact, a lot of our children cry when they hear the sound for the first time. And when we increase the intensity of that stimulus, they cry louder. So that tells us the child is actually hearing or recognizing the sounds. And after this process comes the most important process, which is the auditory rehabilitation, where the child understands the different sounds and learns the speech. So it's like learning a new language. If I were to learn a new language like French, I would go to the class and the teacher would speak to me in French. I would not understand anything. A lot of noise I would hear, but not understand what the teacher is talking about. But within a month, I can pick up some words. Within 6 months, I can say a sentence in French, and within a year, I can speak in French. That's exactly what happens in a cochlear implant surgery. So the first time we put on the implant, we switch on the implant, the patient hears noise, but does not understand anything beyond the noise. It's only with the auditory verbal therapy that they recognize the sounds and learn the language. Benefits of early identification and referral. Now, there are 360 million people in the world that suffer from debilitating hearing loss. It's about 5% of the world's population. Nearly 2 to 4 per every 1,000 children suffer from severe to profound hearing loss. And around 100,000 babies are born with hearing deficiencies every year. Now, the statistics was in 2011, where around 5,000 implants under 4 years of age were done. And that is nothing compared to the number of children born with this debilitating condition. Why is early hearing so important? The most important period of language and speech development is in the 1 to 3 years of age. But most children in India miss out this critical learning period. And untreated hearing loss may mean that some children may never learn to speak after this. Neural plasticity plays an important role in hearing. Now, parts of the infant's brain are pre-programmed, and the auditory system does not mature without stimulation. If you look at the organ of Corti, which I had shown earlier, you have the inner hair cells and the outer hair cells. Now, now in this picture, we have the organ of Corti with the hair cells and the auditory pathway right up to the superior temporal gyrus. Now, supposing the child was born without inner and outer hair cells. When the child is born, the auditory neural pathway is intact, and there is the auditory cortex and the visual cortex. But if there is no auditory stimulation, sound stimulation, over a period of time, maybe 6 years, 7 years, 8 years, the visual cortex slowly takes over the auditory cortex, and that means that there's no point the child undergoing cochlear implant beyond a certain age, because they will never be able to understand or to speak again. So we either use it or lose it. For a child with significant hearing loss, it's very important that they are picked up early and referred as quick as possible. Optimal time to treat a child with congenital deafness is under 3.5 years of age. Ideally, the implant, if it's done below 1 year of age, that will come out with the best outcomes. And after 7 years, beyond 7 years, the results are very poor. Screening for hearing loss. Now, in Ernakulam, that is in Cochin, all the hospitals are covered by the newborn screening program. And this is because of the mandate by the Indian Academy of Pediatrics, Kochi branch. Now, once the babies are screened, they can be screened at the day of the birth. They are then, based on the OA test, we decide whether the patient has any issues or not. Now, infants admitted to NICU can probably be at increased risk of sensory hearing loss. And it's usually parents who sometimes identify hearing impairment. We get older children, it's because of the parents who identify this hearing loss and come to us with this issue. As we all know, some of the causes for hearing loss in high-risk children, asphyxias, bacterial meningitis, perinatal infections like torch, elevated bilirubin, family history, low birth weight, etc. Once a child is identified with hearing loss, it's important to refer them immediately to the audiologist for thorough testing. Fit the children with hearing aids at the earliest. I think that's the key here. Because when you fit the hearing aid, even though the child may not get a lot of benefit from the hearing aids, we are still giving sound stimulus into the ear. And that keeps the neural pathway and the auditory cortex intact. And we can always plan for therapy as soon as possible with the hearing aids, and then followed by, if needed, by cochlear implant surgery. And it's very important that the parents play an active role in this therapy sessions. Treatment options. We have hearing aids, cochlear implants, and bone-anchored hearing aids. I am not planning to discuss more on bone-anchored hearing aids in this talk. We'll be talking about hearing aids and cochlear implants. Now, the important decision to make is, when do we suggest a cochlear implant to a child? And when do we decide if the child needs hearing aid alone and that's enough? When do we decide that? Hearing aids do help a lot of children, but it's not for everyone. What it does is it amplifies the sound that a child is hearing. So coming to the next slide, I think that we can make it a little more simpler. Now, we use hearing aids, or cochlear implants in a child with bilateral moderate to profound sensorineural hearing loss, severe progressive sensorineural hearing loss, speech discrimination scores of 60% or less, even in the best aided conditions. Now, I think this audiogram would kind of explain a lot of doubts that you may have. So if you look at this audiogram, we have the x-axis with the frequencies of sound from 125 to 8,000 hertz. The y-axis is the loudness of sounds in decibels. So we have up to 120 decibels. Now, all our speech is located in this particular graph. This looks like a banana, so we call it the speech banana. If our hearing is within this area, then we will hear normally. We will understand all speech. But if a patient's hearing is way below, say at 80 decibels, and if we get a good hearing aid to this patient, and the patient's hearing dramatically improves to within the speech banana, the patient is able to understand speech and does not need any further treatment. But in spite of giving the best hearing aid, the patient's hearing has not dramatically improved, and it's not within the speech banana, then the patient will not get much help from the hearing aid, and therefore the patient will need cochlear implant surgery. I think this is how we mainly decide whether the patient needs cochlear implant or hearing aids. How does performance with implant solutions compare with hearing aids? Now, in this graph, the y-axis is the age equivalent language ability, and the x-axis is the chronological age of the child. Now, this gray line is a normal child. So a normal child at 2 years of age hears at the language of a 2-year-old child. Whereas if you look at this lines, there are two lines here. The line that's closer to the normal is the child who has undergone cochlear implant at below 2 years or under 2 years of age. Whereas the green line is a child who has not undergone cochlear implant surgery and is usually using hearing aids. So if you notice here, a child with a cochlear implant eventually catches up with the normal, provided it is done at an early age. But a child who is already using hearing aids, even with speech therapy, can never close to the normal level. There is always going to be a gap. So as I mentioned before, early implantation can significantly impact outcomes. Now, this is probably my last graph. This numbers on the y-axis is the category of auditory performance, and this is the chronological age of the child. Now, what is category of auditory performance? We have level 0, where there's no awareness of environmental sounds, and level 7, which is the best, that is use of telephone. So a normal child will be able to start using telephones beyond 2 years of age. Whereas a child who was implanted much earlier, maybe at 6 months of age, will follow the same trajectory as a normal child. A child implanted a little older, maybe around 1 year of age, but under 2 years of age, will close the gap soon. But children implanted at beyond 2 years of age, there is always a lag with a normal child. The take-home message here would be that cochlear implant is a prosthetic replacement for the cochlea, appropriate for adults and children who receive minimal or no benefit with a conventional hearing aid. Neural plasticity is the key to hearing. Hence, early referral of a child with significant hearing loss is important for speech and language development. Optimal age to treat a congenitally deaf child is up to 3.5 years of age, but beyond 7, the results are poor. High-risk children should be screened as early as possible for hearing loss. Patients with bilateral moderate to profound hearing loss with poor speech discrimination scores may be candidate for cochlear implant. And early implantation significantly impacts the outcome. Now, I'm going to show you 2 videos. The first part of the video, first video is on an adult who is 34 years of age. He was born blind and he had hearing till about 16 to 17 years of age. But by around 17 years of age, he started losing hearing in both the ears. Therefore, by 17 to 18 years of age, he became both blind and had no contact with the outside world. And the only way he could communicate was when his mother wrote on the palm of his hands. And you will see that in the video. This is his story. This is his mother writing or communicating with him by writing on his phone. He underwent bilateral cochlear implant surgery, and he is hearing again after a gap of 15 years. Now, as I mentioned earlier, the sounds that the person hears with the cochlear implant initially is just noise. And it's only with training that they understand the sounds. So this is 1 month after surgery where he picks up sounds, some beats. Now 3 months after surgery.
അച്ഛന് ജോലി ഉണ്ടോ? അച്ഛൻ ജോലിക്ക് പോകുന്നുണ്ടോ? അച്ഛൻ ജോലിക്ക് പോകുന്നുണ്ടോ? പോകുന്നുണ്ടോ അച്ഛൻ? ജോലിക്ക് പോകുന്നു. ഇപ്പൊ പോകുന്നു. ഇപ്പൊ 2 മാസം പോയില്ലേ? എന്തൊക്കെ പക്ഷികളുടെ ഒച്ച കേൾക്കുന്നു? പക്ഷികളുടെ ഒച്ച. പക്ഷികളുടെ ഒച്ച എന്ത് കേൾക്കുന്നു? എന്തിൻ്റെയൊക്കെ കേൾക്കുന്നത്? അതോ കുരുവി, കാക്ക, കോഴി, പിന്നെ പൂച്ച. പട്ടികളുടെ സൗണ്ട് അടഞ്ഞു കേൾക്കുന്നു. അതിനുള്ള ബോക്സിന്റെ പാട്ട് കേൾക്കാൻ പറ്റുമെന്ന് അറിയത്തില്ല. ഇവരെ കേട്ടിട്ടില്ല.
After a gap of 14 years. Now I'm going to fast forward to the next video. The next video is the perspective of the parents of 2 children who underwent bilateral cochlear implant surgery.
ഇത് ഞങ്ങൾ ജനിച്ച സമയത്തൊന്നും അറിഞ്ഞില്ലായിരുന്നു ഇങ്ങനെ എനിക്ക് കേൾവിയില്ല എന്നുള്ള കാര്യം. 9 മാസം അത് കഴിഞ്ഞിട്ട് ഇതുപോലെ പെട്ടെന്ന് ഞങ്ങൾ അവൻ കിടന്ന റൂമിൽ ഇങ്ങനെ ഒരു പാത്രം വീണിട്ട് പോലും അവൻ നോക്കണില്ല. അപ്പം ഇതെന്താണെന്ന് അറിയാൻ അപ്പം വീട്ടിൽ എൻ്റെ ഉമ്മച്ചി എല്ലാവരും പറഞ്ഞ് ഈ കൊച്ചിന് കേൾവി കുറവുണ്ടോ എന്ന് ചോദിച്ചു. അപ്പോൾ ഞങ്ങൾ പറഞ്ഞേ ഇല്ല, കാരണം മൂത്ത 2 കുട്ടികൾക്കൊന്നും ഇതുവരെ കംപ്ലൈൻ്റ് ഇല്ല, ഞങ്ങളുടെ ഫാമിലിയിൽ ആർക്കും ഇങ്ങനെ ഇല്ല.
2 വയസ്സ് വരെ അവൻ സംസാരിക്കാതെ വന്നപ്പോഴത്തേനാണ് ഞങ്ങൾ ഇതിനെക്കുറിച്ച് തിരക്കുന്നത്. എന്താണ് സംസാരിക്കാത്തത് എന്നറിയാൻ വേണ്ടി ഞങ്ങൾ ഒരു ഓഡിയോളജിസ്റ്റിനെ കാണണമെന്ന് ഒരാൾ പറഞ്ഞതനുസരിച്ച് ഞങ്ങൾ ഒരു ഓഡിയോളജിസ്റ്റിൻ്റെ അടുക്കൽ ചെന്ന് അപ്പോഴാണ് ഇവന് എന്തോ ഒരു കംപ്ലൈൻ്റ് ഉണ്ടെന്ന് അറിഞ്ഞു.
ഡോക്ടറുടെ ഒരു അഭിപ്രായം അനുസരിച്ച് ഞങ്ങൾ ഇതിനെക്കുറിച്ച് പറഞ്ഞ് കേട്ട് അറിഞ്ഞ് ചെന്ന് ഈ മിഷനറിയിൽ ഏറ്റവും മികച്ചത് കോക്ലിയർ ആണെന്ന് ഒരു അഭിപ്രായം കേട്ട് ആദ്യം ചെയ്ത ആളുകളെ കുറിച്ച് അന്വേഷിച്ച് ചെന്നു. അവരെ കണ്ടു പരിചയപ്പെട്ടു, അവരോട് സംസാരിച്ച് അവരുടെ കുട്ടിയുടെ ഇമ്പ്രൂവ്മെൻറ്റ് കണ്ടതിന് ശേഷം ഞങ്ങളുടെ കുട്ടിക്ക് വേണ്ടി ഇത് ചെയ്തു.
ഓൺ ചെയ്ത് ഒരു 2 സൈഡ് ഞങ്ങൾ ഇംപ്ലാന്റ് ചെയ്ത്. അപ്പോൾ ഡോക്ടർ പറഞ്ഞ് ഒരു സൈഡ് ചെയ്യുന്നതിനെക്കാട്ടും കൂടുതൽ 2 സൈഡ് ചെയ്താൽ നല്ല ഇമ്പ്രൂവ്മെൻ്റ് ഉണ്ടാവുമെന്ന് പറഞ്ഞ് അങ്ങനെ ഞങ്ങൾ 2 സൈഡും സർജറി ചെയ്ത്.
പിള്ളേർക്ക് പഠിക്കാനും എല്ലാം 2 ചെയ്യുകയാണെങ്കിൽ നല്ലതെന്ന് പറഞ്ഞാണ്. അപ്പം ഞങ്ങൾ 2 ചെയ്യുമായിരുന്നു.
അങ്ങനെ സർജറി കഴിഞ്ഞ് ആണ് സ്വിച്ച് ഓൺ ചെയ്യേണ്ട ദിവസം വന്ന്. അങ്ങനെ ഞങ്ങൾ ക്ലിനിക്കിൽ വന്ന് സ്വിച്ച് ഓൺ ചെയ്ത്. അപ്പോൾ ഭയങ്കര പ്രതീക്ഷയായിരുന്നു ആദ്യം കേൾക്കുമ്പോഴുള്ള ഇതെങ്ങനെയെന്നറിയാൻ.
അദ്ദേഹത്തിന് അവൻ ആദ്യം ഇത് സ്വിച്ച് ഓൺ ചെയ്ത് സൗണ്ട് കേട്ടപ്പോഴത്തേനും അവൻ ഭയങ്കര കരച്ചിലായിരുന്നു. അപ്പോഴും ഞങ്ങൾ ഡോക്ടർ പറഞ്ഞു നിങ്ങൾ വിഷമിക്കേണ്ട, കരഞ്ഞതാണ് അവൻ്റെ കേട്ടു എന്നുള്ളതിൽ ഏറ്റവും നല്ല ഇതെന്ന് പറഞ്ഞപ്പോഴാണ് ഞങ്ങൾക്ക് സന്തോഷമായി. അത് കഴിഞ്ഞ് പിന്നെ തെറാപ്പിക്ക് ഞങ്ങൾ വരാൻ തുടങ്ങി.
അവൻ്റെ പേര് റംസാൻ എന്നാണെന്നും ആ പേര് വിളിച്ചാൽ തിരിഞ്ഞു നോക്കാനുള്ള ഇതെല്ലാം കാണിച്ച്
ഒരു 2 ആഴ്ച കഴിഞ്ഞപ്പോഴത്തേനും അവന് മാറ്റായി. പിന്നെ അവന് വണ്ടിയുടെ ശബ്ദങ്ങളൊക്കെ തിരിച്ചറിയാൻ തുടങ്ങി. അതുപോലെ ട്രെയിനിൻ്റെ ഒച്ച, ബസ്സിൻ്റെ ഒച്ച, അതെല്ലാം അവൻ തിരിച്ചറിഞ്ഞ് വന്നു. 2 മാസം കഴിഞ്ഞപ്പോഴത്തേനും അവൻ പയ്യെ എല്ലാം പറയാൻ തുടങ്ങി. പപ്പ അങ്ങനെയൊക്കെ എല്ലാ കാര്യങ്ങളൊക്കെ പറയും.
2 ചെയ്ത കാരണമാണ്. ഒരെണ്ണം ചെയ്ത് കഴിഞ്ഞാൽ അവർക്ക് ഒരു സൈഡിൽ നിന്നല്ല കേൾക്കാൻ പറ്റും. 2 ചെയ്താണ് നല്ല ബെറ്ററായിട്ട് 2 സൈഡിൽ നിന്ന് കേൾക്കാൻ പറ്റും. അതിൻ്റെ അനുസരിച്ച് നല്ല ഇമ്പ്രൂവ്മെൻറ്റ് വരാൻ തുടങ്ങിയിട്ടുണ്ട്.
മുമ്പ് മറ്റ് 2 കുട്ടികൾ ഞങ്ങൾക്ക് മൂത്ത 2 കുട്ടികളുണ്ട്. അവരെ പോലെ ഇവനില്ലല്ലോ എന്നുള്ള ടെൻഷനായിരുന്നു. പക്ഷെ കേട്ട് കഴിഞ്ഞ് ഇപ്പം അവരേലും ആള് ബെറ്ററാണ്. ആളുടെ അടുത്ത് ഞങ്ങൾ വലുതാകുമ്പോൾ ആരാവുമെന്ന് ചോദിക്കുമ്പോൾ എനിക്ക് പട്ടാളക്കാരൻ.
നമസ്കാരം.
And this is the same child saying Happy Onam, and you can just hear the way he pronounces those words.
Happy Onam.
And this is the child we operated first about 5 years back. And I'd like to end this talk. Thank you very much for your patient hearing. Thank you. Are there any questions?
Thank you, sir. Thank you so much.